in the moment, we're not thinking like that. You
That's
know,
right.
we had to really find those people to really talk to us. And what I love is that you mentioned people just making people feel like they want to come to work. You
Yeah.
know, and I feel like as a leader, you see it time and time again where they feel undervalued. And I think that's what really kind of happened in the health care space during the pandemic. People
Oh,
just felt overworked, undervalued. And we've seen so many people leave. You know, also they were doing work they probably didn't want to do, but
that's
now
right.
we're in a space that I think that technology is taking on a lot of those admin tasks, doing a lot of the things that people hate to do and allowing more people to do what they love. Are you guys kind of on that wave of implementing AI technology that can actually do that for your staff and your team?
We are. I'm spending a lot of time, researching and looking at that space. We've implemented a few things. One of the most difficult things I think for nurses and doctors is the electronic medical record, which is
Yep.
you spend half your time typing in it, hours and hours a day, and that time should be focused on the patient and what you were trained to
Hmm.
do and caring for people. And if you, anybody who's been to a doctor appointment just knows how annoying it is as you're trying to talk to your doctor or the nurse, and they're like with their back to you typing into the computer. And the doctors hate that too. And then they often have 2 hours of continuing to type stuff in the evening. So a lot of health systems, including ours, have implemented this new AI technology where it listens to your visit and it populates that note for you, and it puts the correct things in the correct places, and it takes away all that data entry so that clinicians can get back to being with patients. But it's funny. There's things that I saw demoed, a year ago that I was thinking, oh, it's almost like science fiction. And you're thinking, oh, that'll be 5, 10 years from now. And now it's like a year later is ready for prime time. They have these chatbots that are essentially nurses chatbots that will, you know, talk to patients, get them scheduled, make sure they're on the right medications. And if somebody's lonely, just talk to them, about different things. And then the next time it calls you, like a month later, it'll remember what you were talking about and where you left off. And it's just astounding to see that we're at a situation like that. But I agree with you. I think the hope, the promise of AI is it's going to take a lot of these uh, non-value add sort of just custodial tasks that everybody hates to do, take that off of our plates so that we're able to get back to our connection with people and our patients. That's the hope. But there could be risk out there with super intelligence and everything else too. I grew up watching Terminator and The Matrix. And you're like, oh, okay.
That's why you bring Terminator. Somebody brought up I Robot the other day, and I was like, "Yeah, those are all good movies, man. That
Yeah,
it's happening. It's here. When you
yeah,
think about, we are selling, or Elon Musk is going to start selling robots.
yeah. I know.
That you
It's
can
yeah.
have. So it's like crazy times, man. Just
Yeah,
really
I
crazy
was in
times.
Phoenix a couple months ago, and you see these Waymos driving around everywhere without people. Like they're just self-driving
Wow.
cabs, and you're like, how are we? It's like a science fiction movie that I would watch when
Yeah.
I was a kid. Yeah, it's crazy.
I yell at my friend all the time because he likes to drive his Tesla,
Oh yeah.
and I'm talking to him, and I can tell that he's not listening because he's doing something, but he should be driving, right? And I said, "Sir, what are you doing?" He's like, "I'm editing a video." Sir, if you
Oh
don't focus on the road, what are you talking about, right? People are so reliant on this technology, and I
yeah,
think that we're going to have a lot of young leaders that are going to get into this healthcare space and says, where's the AI? All
yeah,
right, they're already learning it. Where's the AI here? Like, we need
yeah,
technology, which is a good and a bad thing, but
yeah,
it shows that we have to kind of adapt to the next generation.
yeah,
When we thought social media wasn't going to take over, I mean, the internet wasn't going to take over.
yeah.
Now, I mean, we can't live without internet and
That's
Wi-Fi.
right. Yeah.
So yeah, definitely crazy times, man. But it's cool to see that you guys are in the space of how do we implement AI to make lives easier for us to do the things that we truly love. So that's actually pretty cool on that sense, man. But thinking about where you're at today, man, what does the next 5 years look like for you? What are you trying to accomplish, whether it's a personal, whether it's within the organization?
Yeah, within the organization, as I've come into the CEO role, I'm in the middle of developing that 5-year strategic plan, and I like to think bold. I'm trying to think big. So things that we're working on, first, one of the big problems in healthcare is we don't have enough workers. We don't have enough doctors, nurses, therapists, pharmacists, you name it, we don't have it to serve the needs of our community. So
Mhm.
we're going to start doing that ourselves. So I'm in the midst of planning a medical school. We might be able to tailor in a school of pharmacy.
Okay.
We've worked very closely with our community college on nursing program expansion. And so we are converting from a community health system to an academic health system. That is sort of the vision of the next 5 years so that we can, and the other things it can do is integrate more sophisticated higher end care. It can integrate, hopefully, these new technologies. It'll provide the chassis for research, development, maybe even AI incorporation into the healthcare space, and then training the next generation of physicians and doctors, nurses, and other healthcare professionals. So it's a big investment. It's a big move, but our community is very, very rapidly growing here in the Northern Virginia area, and we have to grow with our community to make sure that everybody gets the healthcare they need.
I love it. Yeah, especially now. I see that you're really growing out for the next 5 years. We're in tough times right now. What are some of the challenges that you're seeing? Things that I'm hearing when I think about today's is that people are in fear to go to the hospital now or to go to their doctor's visits, not knowing if they're going to get back home or not. Right? It's affecting the nonprofit and the healthcare space, but it's just affecting families in general. What are some of the things that you guys are doing to make sure that you guys help those people that are living in that kind of fear space?
We want to make sure our community knows that we're a safe space. We are the safe space where you can come. We do not want to be in a situation where people are not getting life-saving health care out of fear of their documentation status or that sort of thing. So we are not, we're not law enforcement, and law
Hmm.
enforcement has an important job, and but that's not what we do, and we certainly have to cooperate, but. We want our community to know that we are a safe space. There's confidentiality when you talk to your healthcare provider. We're not reporting anybody to anywhere. What the last thing we want is somebody to have a bad health outcome because they're afraid to come to the health system for care when they need
Yeah,
it. So,
that's good to
um,
hear. That's
yeah.
good to hear.